Biofeedback is a method where we measure biological signals such as muscle activity or body movement, and then present the processed signal back to the patient. The signal can be presented to the patient audiovisually on a computer or mobile device screen, or as an audio signal through, for example, the headphones. Measurement by electromyography is commonly used when treating women affected by urinary incontinence. Electromyography uses vaginal or anal device to measure the electrical activity of pelvic floor muscles. We can also measure vaginal pressure, which is known as periodometry. We can also measure the movement of pelvic floor muscles using the ultrasound to see how the muscles move during the muscle activity. Raw EMG data is collected from each EMG channel. EMG is recorded in high frequency in order to collect all the relevant information, including the most rapid muscle reactions. For the viewer and software, this kind of raw data has to be processed in order to make it easy to analyze. This process includes automatic filtering of artifacts and averaging the signal for each channel. By combining these sequence values, the signal can be represented visually by, for example, line graph. Biofeedback gives information on how well the muscle contracts when the person contracts them voluntarily. It can help the woman to find the right muscles instead of gluteal or abdominal muscles or thighs. Biofeedback also gives information on how well and fast the muscle contracts and relax. Sufficient relaxation between contractions in the exercise program can be ensured when the timing of exercises is properly planned. In pelvic floor physiotherapy, the patient is provided with a personal training program, encouraged to work independently and to track their progress. You can incorporate this training program into the biofeedback devices, which has a suitable amount and varying types of exercises. It is easier to practice maximum, fast or endurance training by following the graphs. By biofeedback, the patient can also practice pre-contraction of the pelvic floor muscles. It can be made in the situation where urinary leak happens, for example, coughing or lifting. By using biofeedback in pelvic floor physiotherapy, it can be more effective and the individual progress can be followed. When training the pelvic floor muscles without biofeedback, using a training program written on a paper, it can be more difficult to do the exercises correctly. It can also be more difficult to follow the individual progress. The results of each exercises can be saved, and an automatic training diary can be generated. This way, it is possible to follow the progress of exercises over time. This is important so that the undertraining and overtraining are avoided. When following the progress, it is important to do the measurement of pelvic floor muscles always at the same position, and only individual comparison can be made. Biofeedback can also act as a source of motivation. When the patient sees the positive progress, she usually wants to maintain the training habit. Active follow-up of the exercises by a therapist or an automatic training calendar adheres patients to the training program.